Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 44 of the Ask Dr. Angela podcast. So, I had a great day today. I hope you had a great day today. One of the reasons my day was so great is that I finally completed my maintenance of certification requirements. And basically what that is once you attain board certification, it's the American College of OBGYN's way of making sure that you stay current. And so I had to read a whole slew of articles based on, evidence-based medicine, safety, and current protocols, and then answer a bunch of questions about it. I think you have to get like 80% of them right in order to get credit. And while it's kind of a pain in the ass, I do find that the articles are not only very interesting, but also very helpful in terms of deciding what I will and will not implement into my current practice. So speaking of current practice, I think I told you that I am the queen of the curbside consult. Whenever I am out getting coffee or just, again, minding my own business and someone strikes up a conversation with me, and, when you find out what I do, it's always, okay, I just got to ask you this. So I was recently asked about birth control, sex drive, and what to do. The young lady that I was speaking with had recently started a new birth control pill. And when I say recently started, I'm going to say like within the last 6 months or so, in a brand new relationship. And she feels or felt as if her sex drive had decreased. Now, giving you a little bit more to the story, you have to know that this young lady was in her late 20s, had 3 kids, and a couple of stepkids, and her partner was a little bit older than her. When I say a little bit older, I'm going to say like 7 or 8 years. So she says to me, Dr. Angela, I think it's my pill. And so I said, okay, you think it's your pill. So this is what you need to know about the birth control pill. Yes, the birth control pill certainly is associated with decreasing androgen levels in women's bodies. What you need to know about androgens is that's like the chemicals or hormones that are highly or largely responsible for your sex drive. And so my general response to women that come to me and say, oh my gosh, I think that the birth control pill is causing my sex drive to be significantly decreased, the first thing that I always ask them is, well, what else is going on in your world? And in this young lady's case, she was working 2 jobs. She was transporting the kids back and forth to activities. She's the one that cooks dinner. Just a lot going on. And so I simply said to her, first of all, even if you weren't on the birth control pill, you're not the only woman that I've met, even recently, that's complaining of decreased sex drive. And why? Because look what all you have going on. When you look at the top 5 things that you need to accomplish throughout the course of a day, where does sex fall on that list? Does it even make the list? And the reason that I bring that up is that so often we have so many things going on. I mean, women are doing it now. I mean, we're not just stay-at-home moms. We have careers, we have kids, we're still cooking dinner, maintaining a household, and you're probably tired and stressed. And you know what stress does. Stress is, I'm sorry to say it, but stress is a real MF. I'm not going to say it on the air, but you know what I'm talking about. So to make a long story short, stress, fatigue, being tired, and let's not forget, for us women that, are not that thrilled with our bodies or how we look, I don't happen to be one of them. Self-esteem and feeling good about yourself, that all plays into sex drive and wanting to do it. I like that, wanting to do it. And, the other thing that sometimes we have to do, and I'm a working mom, my crazy schedule is like all over the place, but you have to sometimes pencil it in. A little afternoon delight, schedule it at lunch, get in where you fit in. But I'm saying this because sometimes you just have to make it a priority. Schedule a date night, make it happen. Go on vacation. Notice when you go on vacation, the sex is not an issue because we're not stressed, we're relaxed, we're having a good time. So having said all of that, while the birth control pill can be associated with decreased libido, and again, it can. You read like the fine print on the packets of your birth control pills, and it will say decrease in sex drive is a possible side effect, along with 1,000,005 other things. I would caution you to not give up on the pill or whatever you're using just yet, and try to address some of these other issues. And certainly, if you do think that it's your birth control pill that's the issue, you may consider trying an alternative form of contraception, perhaps something that is non-hormonal, or just coming off of it for 3 months and seeing what you think. Woo! That was a lot, right? But anyway, thank you to that young lady that presented me with this question. I certainly don't lack for the gift of the gab, and so I was really happy to address this for you. For those of you that have a topic or a concern or a question that you would like featured on the Ask Dr. Angela podcast, please go to www.askdrangela. That's AskDrangela.com. Click on the microphone on the right-hand side of the page and do what you do. If we do feature your question on the podcast, someone from my team will be reaching out to you and we will send you one of our new and improved bomb-ass t-shirts. In closing, I'd like to leave you with these words from Albert Einstein. If you always do what you always did, you will always get what you always got. Let's think outside the box, people. Until next time, look better, feel better, be better. I am so looking forward to reconnecting in episode 45.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.